to be involved with the Grampions organization in the greater Illinois area. It's been a pleasure for us to be the co-chairs of the Chicago chapter's Grampian program, as well as members of the National Grampians Committee. Tonight, we have Grampians gathered from across the country, all the way from Pennsylvania to Nebraska to Indiana. When we think of the milestones the foundation has accomplished, like finding the CF gene, developing CFTR modulators, advocating for affordable care for people with CF, it has taken people across the entire country to get to where we are today. But we still have a long way to go to find a cure for all people with CF, which is why we're excited to gather together this evening. You know, one of the great privileges we have is an opportunity to meet other people who share the same common goals as we do. So we'd like to start the night with going into breakout sessions where we'll get to know others from different states. Now, when we split into the breakouts, we would like for you to share your name, where you live, and some information about your loved one with CF. Tonight is all about the past, the present, and future milestones for CF, so please share a milestone your loved one has accomplished. We'll get back with you in about 15 minutes. Hannah, it's all yours. No, again, I do hope you all had a great time in your breakouts. I know we did. It's always fun to get to know some new people. We got to meet somebody from New York and two people from Indiana, and one of them we already knew. But anyway, it's just always fun to meet different people from different places. So I hope you got the chance to do that and share with, those breakouts. I always find that we never seem to have enough time to do what we want to do. So now we got to talk a little bit about care centers. And I know care centers, we all know, really are essential to our loved ones' health and ongoing fight against CF. Well, tonight we have the pleasure to introduce Paula Lomas, who is the Senior Director of Clinical Communications at the Foundation, who's going to lead us in a conversation on care center accreditation. Now, Paula has 26 years of experience working with children and adults with CF and their families in the role of nurse coordinator. She has also been a research coordinator for various CF clinical trials and is a credentialed quality improvement coach and advisor for CF Care Model Design Project. She's passionate about improving on care delivery for all. Feel free to write a question in the chat box, or if you want to wait and unmute yourself at the end of her presentation, we can handle questions then. Paula, thank you for joining us tonight.
Oh, thank you, Ken. It's really a privilege to be here. And I think Hannah is going to put my slides up and we'll get started. Don't want to waste any time, but I have been invited to speak to you about CF Care Center accreditation. And as was mentioned, my story started in 1988. I started at a CF Care Center. So I've been able to see so many things and been part of so many great strides in the CF community. We'll go to that next slide, Hannah, and just start at the beginning, right when the CF Foundation first began in 1955. There are a lot of different photos that people use, but this is my favorite photo, and I'll tell you why. This is Dr. Milton and Evelyn Graub, and I had the great privilege of working with Dr. Graub back in the 1990s at Hahnemann University. Dr. and Mrs. Graub had 3 children, and 2 of their children, Kathy and Lee, had cystic fibrosis. And their 3rd child, Pearl, is still living. And Dr. Graub used to tell us of those days, those early days, when he would hear about someone, a family who had a child with CF, and he would get in the car and drive within a 90-mile radius to go visit them. Oops, let's go back to Dr. Graub. And just to offer them some hope, when he knew that there was really very little, but also for him to be able to come alongside them. And he knew that they needed to get together, they needed to form together, they needed to raise funds, and they needed some funding for research. So that is why I like to show the picture of Dr. Graub. So let's go to that next slide. And our care model is really centered with the individuals with CF and their families at the center of all that we do. But it has 4 key areas. That is coordination of care within the care team, across care teams, across specialties. Also, we work to empower individuals with CF so they have the information and resources that they need to make good decisions and well-informed decisions. We also have a key area of improving, taking a look at data and working together to drive for improvements. And also, you know that we have a very caring community. So we like to make sure that we give everyone a sense of belonging. So that is our CF care model. We'll go to the next slide and talk really about that area of coordinating the personalized care, as we'll discuss center accreditation and what that means and what that relationship between the care center and the CF Foundation is all about. So let's go to the next slide and talk about the beginning of care centers. Well, believe it or not, the first 2 care centers, the first 2 accredited care centers were in 1961. That's a long time ago. And I always like to ask, but I'm going to tell Bonnie she's not allowed to answer because she already heard this part of the talk. Take a guess, you could put in the chat, of where you think the first 2 accredited care centers were. You can put it in the chat if you have a guess. I will say there were care centers throughout the United States. These were the first 2 that were accredited. And the way that we know that is that every care center, every program has a number. And basically, they are numbered in the order of when they were accredited. We had 1 guest in Florida, 1 in Pittsburgh. That's interesting. Indiana. Well, actually, a lot of times people will say New York, like New York City, because of course, Dr. Anderson was in New York, and Boston had a big program in the 1961, but the first 2 accredited care centers, the first one, this always shocked me, was Albany, New York. Albany, New York. Yeah. Remember, that was the first one. And the second one was in Atlanta, Georgia. Anyway, useless trivia, but it's always fun. Fun to talk about that. Yay for New York. We saw some rapid growth during the 60s and 70s, rapid growth of accredited care centers. I can't tell you what accreditation looked like exactly back in 1961, but I can talk a little bit more about what things started to look like for adult care, because I was around during the 80s when the adult care model was becoming more popular, and we knew that we needed to deliver age-appropriate care. We had a group come together and had consensus about what that model of care should be. And that group came together in 1997, and that was published. But I will tell you, there were adult providers and adult programs before 1997. I worked with one of the first adult providers, and he was brought into the CF community in the mid 80s. And Dr. Bruce Marshall, who many of you may know, he is VP, Senior VP of Clinical Affairs at the CF Foundation. He started as an adult provider back in 1988. So we did have adult care providers long before 1997. And in fact, the CF Foundation mandated adult programs in the year 2000. And that was, I will tell you, I was around during the year 2000, and that was tough because it is hard to leave a pediatric program, a team that you trust, a team that you love, a team that you've grown up with. But it really is important that age-appropriate care is delivered. None of us can stay with our pediatricians forever, right? So we all have to move on. And adult care is different. is different than pediatric care. So it's important. There are different screenings. And I am sort of the complaint department at the CF Foundation when it's complaints from families. And I do get a lot of calls. And I understand it. I will tell you, I understand it. It is hard to leave a program and to move on. But like I said, it should be seen as a graduation. It should be seen as something that's expected and important to do. So let's go to the next slide and just show you how many CF care programs there are throughout the United States. We really do have a robust care center network. We have 133 care centers, and that is including 129 pediatric programs, 118 adult programs, and 41 affiliate programs. So we see at the CF Foundation, we consider a care center, a pediatric program, and an adult program together, and they may have an affiliate or two. I know that there are some people here from Riley, and I know that Riley Children's Hospital has an affiliate program. So we'll talk a little bit more about what that means. Let's go to the next slide. So accreditation, why is it important? Why do we encourage accreditation? Why do we encourage individuals with CF to attend an accredited care center? That is because we then know that there is a standardized method of care delivery. There are care standards. There is a multidisciplinary care team. There are things that we expect of our accredited care centers, but there are also things that they can expect from us, the CF Foundation, and the support that we give. So let's go on to the next slide, where it really gives us a sense of what does accreditation mean, but also what is that affiliate center? What's the difference? So accreditation, if a team wants to become an accredited care center, they would make an application to the CF Foundation. They would then have to go through a review. They would have a site visit, and then an individual from the CF Center Committee would go to that program and really take a look at everything. They take a look at the charts. They'll take a look at the sweat test lab, the microbiology lab. They will make sure they will go onto the inpatient unit, the outpatient unit. They will talk to radiology. They will talk to administration. That site visit will happen before a program gets accredited, and it will also happen at least every 5 years, at least every 5 years. Then that site visitor comes back to the center committee. That committee meets twice a year in May and December. They make their recommendation. They tell the committee what they saw, and then the committee votes. The committee of center directors, it's not just a committee of CF Foundation staff. The CF Foundation staff really don't have any vote in this. This is really a peer review, right? So these are other center directors that go and visit. These are other center directors that decide, is this an appropriate care center for approval for accreditation? And they make their decision, and then that program will be accredited or not. That would be the first visit. We don't typically like to remove accreditation because we know that that program supports many individuals and many families. So we would prefer to help that program improve, to help them to get to the standard where they need to be, to make sure that they are meeting established criteria. So that is what the site visit is all about. But annually, the care center is required to write a report. And a group of us from clinical affairs goes through that report, and we make sure that if we see any red flags, that program might get a phone call, or maybe they'll get a letter saying, we noticed that your staffing is not up to par and that you need to work on finding, let's say, a social worker to fill those fill those that position. So that's what accreditation is about. Teams who are accredited are also required to consent individuals and the family if the child is too young to complete an informed consent for their patient registry. That really is an important tool that we have in our toolkit. And we'll talk about that in a little bit. And part of being a care center means that you do receive some funding from the CF Foundation. But what's the difference between a care center and affiliate program? Like, what is it? And basically, an affiliate program only needs to have 20 patients with CF. A full care center has to have at least 50. So they have 50 or more. They also all have to do some sort of research and have a multidisciplinary care team, and to be able to provide age-appropriate care, and to also be able to provide care from specialists. It doesn't necessarily have to be in that program, but some sort of referral process has to be in place. So that's the difference between accreditation for a core program and an affiliate center. So let's move on to the next slide. I mentioned the care team. This is an important part of accreditation. This is an important part of our care delivery. We have required team members, and again, the CF Center Committee has decided who the required team members are as compared to the recommended team members. Each team needs to have those required team members, and the recommended team members are not something that we would give them a phone call about, or write a letter about you need to have this team member. But it is something that really we have found has supported the care teams. Reasoning why sometimes the center committee has not decided to have some members, like a psychologist or a mental health coordinator, to be a required team member, really is financial. These members team members are not CF Foundation employees. They're not CF employees. They're employees of that institution. So it's really very hard to require much more than what we have already, because there is quite a financial burden to the organization. So let's go to that next slide and just talk about how the CF Foundation supports care centers through training and supports those care team members. That would be through our quality improvement initiatives, as well as our workforce development, through finances for adult care excellence, the PACE program, to make sure that we have adult providers who know about CF. We have mentoring programs. We have had grants for mental health, for physical therapists, for pharmacists. We have a program for gastroenterologists to make sure that they understand the difference with CF and GI issues. And we have more senior GI physicians partner with more junior GI physicians so that they can learn. We have a similar program for endocrinologists. We also support our care teams through clinical care guidelines. And during that accreditation process, they are required to show that they are following those clinical care guidelines. And of course, we make sure that we train people through the North American Conference, which will be coming up in October of this year. We'll go to the next slide, and I just want to say we have discipline mentoring programs. We want to make sure that all of the care team members feel supported and have someone to go to should they need to. What we do is we match and we pair more senior individuals with people who are more junior individuals, and that includes a site visit. And they have probably a 6-month relationship, but they have one site visit, and this is really a very strong and a very popular program for clinical care individuals from the care teams. So we'll go to the next slide. And I mentioned our clinical care guidelines. I've even lost count on how many guidelines we have, in all honesty, but they are all posted on cff.org. If you would happen to be interested in any of them, and go to the next slide, and I'll tell you, you don't have to read the whole guideline. What we have decided to do is, for each guideline, we have executive summaries. So we summarize the guideline for you there, and then we tell you what the key recommendations were regarding the guidelines. I will say our guidelines are guidelines, except for the infection prevention control. And that's really much more, I'll use the term mandate. But the other guidelines are really meant to help the clinician know what standard of care is. But sometimes when you're in the room with someone, maybe there's certain standards of care that just won't work for that individual. So again, they are guidelines, except for that infection prevention control. We'll go to the next slide. And I just want to mention that we have supported our care teams through 2020 with more information about telehealth. Our care teams really were not prepared for telehealth, in all honesty, most of them before the pandemic hit, but we really have tried to come alongside them and given them some guidance along the way. And of course, many of you know that we have provided spirometers to any individual with CF. We started out that they needed to have a number in the patient registry, but we have worked with some care teams because some individuals, for whatever reason, they do not want to consent to have their information put into the registry. And we did work through that. We wanted to make sure anyone with CF who wanted a home spirometer could receive a home spirometer. We'll go to the next slide and just mention how the CF Foundation works with accredited care centers with our partnerships for sustaining daily care. I mentioned our guidelines, and our guidelines are more the science of medicine, right? They're evidence-based. The recommendations are usually based on published evidence, or if there isn't any evidence, it's based on consensus of specialists. Partnerships for Sustaining Daily Care is really a way that we help our care team members with communication skills. What happens in that exam room, how to speak to people so that you have an open, honest dialogue. And our Partnerships for Sustaining Daily Care team has been working very closely with care teams in regards to this, because they understand that individuals with CF and their families are specialists about their lives. They're experts about what's happening in their lives. And of course, the care team members are experts in CF care. We'll go to the next slide and just quickly mention that we, as the CF Foundation, do support CF care teams financially. I want to tell you how proud I am of the CF Foundation, because most organizations that accredit or certify or make a center of excellence, usually that organization, usually that hospital organization will have to pay for that accreditation or for that certification. And the CF Foundation, of course, does not ask for payment from our care team hospitals. We actually pay them. We support them. We want to make sure that they have the individual on the care team that will put information into the registry, that will be able to consent people, and that those individual teams have that multidisciplinary care team member. So I always like to make sure that I say that, because I don't think that people realize how unique that is. And the CF Foundation is really a phenomenal organization in that way. In 2020, We did fund for mental health care coordination. That was new, and that is something that we really have gotten behind, and that is mental health care and supporting the individual with CF as well as their families. So someone asked, how do we, CF Foundation pays them, we give them a grant. We give the care center an annual grant. They have base funding based just on for administrative funding, and then they can have additional funding based on the quantity and quality of data that they put into the patient registry. So that really goes to the fact that if you are a larger care center, you will be putting more data into the registry, you will be receiving more money. And if you're, and because you probably need more money, and if you're a smaller care center, you wouldn't be receiving quite as much funds. So I hope that that answers that question. The grant is it's on the fiscal year. You can go to the next center. Do care centers change a lot? And I'm not too sure really what you mean by that question. So we'll get to that when we get to the questions, because I'm interested in answering it, but I'm not too sure I understand it. Quickly about the registry. The registry is a way that the CF community can take a look at treatments and see if we're getting the outcomes that we want. So we have the patient registry data report that is posted annually on cff.org, usually around the time of the North American Conference. We have a highlight report. You can go to the next slide. And we also have individual reports for the accredited care centers. I point all this out because I'm trying to show you that accreditation really is a relationship between the care centers and the CF Foundation. And we are committed to support those care centers and try and help them, because most care team members do more things than just CF. And sometimes people don't realize that. They are a CF care center, but most of the time, the only individual that might be full-time CF might be the program coordinator. And everyone else does other pulmonary diseases usually. So I just like to make sure that people understand that. Let's go to the next slide. And I just want to say, this is our portal, and this is a way that care team members can get onto the portal. They can get in touch with one another. We have CF Exchange listservs for the disciplines, and they also can access resources in our resource library. All care team members have an account on my.cff. Moving to the next slide and just mentioning that we do provide resources for the care team members to use. And this is really to help with the implementation of their guidelines. And we'll go to the next slide. And of course, we encourage all of our care centers to get involved with their local chapter in many ways. And we appreciate that our chapter supports their local care centers. So as I mentioned, and I hope you've heard it over and over, it really is a relationship. That accreditation brings them into a different relationship with the CF Foundation. So let's go to the next slide and bring up your questions. So I'm not too sure what the question about, do care centers change a lot? And if you mean if their care team members change a lot, some yes, some no.
Okay, this is Mary. Can you hear me?
Yes, Mary.
All right. So my question was the fund, I think it was more for the funding of the care centers.
Yeah, it usually is about the same for each care center from year to year, because they get the same base for their administrative costs.
Okay.
And then they usually have the same number of patients. So it's usually around the same amount that they get year to year.
So then the funding, all right, let's say the funding increases 20%. Is it all equally distributed amongst the care centers?
Yeah, there's a little bit that goes into it's not divided that way. it's not divided that way that we have X number of dollars and we're going to divide it. Usually it's from year to year, the administrative costs remain the same. The care center costs for the bonus that they get for each individual on the registry usually remains the same. So usually year to year, it's about the same for that individual care center. But if you have a smaller care center, it's going to be less because you have less people in the registry. I will say that and also I'm bragging on the CF Foundation. The registry data was not quite so robust in 2020. People didn't come into clinic. They didn't have as many visits. So they didn't have as much data in the registry. But the CF Foundation was committed to making sure that those care centers did not fail, did not have a financial strain, and they decided that every care center was going to get the same amount that they got the year before, even though most care centers, almost all care centers, did not put the same amount into the registry. So.
Okay, so I have a question. If I was to leave money towards a CFF when I die, can I allocate it to a certain care center?
I honestly don't know, but that might be a good question. Maybe Amanda has that information. I don't know. So Amanda.
I would love to answer that question. So I will say we don't know how the foundation will evolve over time. We can't guarantee that a care center won't merge with another care center, but we always want to honor the intentions of a donor. So we're going to do everything we can. And recently we worked with a family that had set up a trust that wanted to keep that plan gift restricted to a certain region to make sure that it was supporting the foundation locally. And we will absolutely make sure that that gets honored. But generally speaking, restrictions are harder to do with plan gifts because you don't know when they'll be realized, and we don't know what will be needed or what our priorities will be at the time. And we want to make sure that we capitalize on what those top priorities are at the time. So we hope that just like anything else with our investments, that it's always the biggest impact at that time.
Okay, so can I set up a living trust? I mean, as I'm still working, can I set up a trust with the CFF?
Yes.
Instead of an IRA or a 401k, you know, making sure that money is allocated.
Mm-hmm. Yes, and I will say, I'm going to talk a little bit today about the easier, more common ways that people leave plan gifts. Trusts are always a lot more complex, and we can talk separately about it because we want to make sure that we do right by you and that you get everything you need to set that up. So, I mean, I'm going to say yes, and let's talk some more.
Yeah, great, man. This is a good segue into bring you on for this. And Mary, thanks for all your questions. They're really good. Thank you, Paula, very much. It's been a pleasure hearing about all the quality work you and the foundation have done to fight against CF. And on behalf of those that are participating tonight and all the Grampions, we want to thank you for your dedication and work that goes a long way to improving the quality of life for all. So we've already gotten started, but I do want to introduce to you Amanda Czar, who is Director of Planned Giving and for the National Foundation. Amanda actually came into that role in April of last year, if I'm correct.
Right during the pandemic.
What a trying time to do that. What a great trying time to do that. But we actually had the pleasure to work with her to set up our commitment for Legacy Giving Program. And she's with us tonight to share a little about the Milestone 3, the Foundation's new giving campaign. Amanda, it's all yours.
Thank you so much. I know Hannah's got a slideshow for me too, but I appreciate the icebreaker to start talking about planned gifts. It's so much better when it comes from people on the call. So if we want to go back to the first slide there, Hannah, thank you. I'm really excited to be here. And Paula, it's an honor to join after you because I think you give such a great sort of snapshot of our history and where we've come from and all of the efforts we've put into supporting patients and care, and kind of now we're thinking about the future and what that's going to look like, and the research we're investing and what the care model of the future looks like. And so plan giving is very much a part of those plans. And how we invest in it. So thank you, Paula, for being our expert and joining us tonight. So I'm excited because we're actually launching the third major gift campaign in our foundation's history. And this builds on a very successful history of our Milestones 1 and Milestones 2 campaigns. And for those of you that may not be familiar with that history, those campaigns actually raised more than $250 million in about a decade. And all of that funding was given 100% directly into research and care. And so Milestones 3 is a very natural evolution of the names of where we've come from, but you'll see that there's a tagline, a new tagline for this campaign, which is called Driven by a Dream. And I especially love this tagline, which we haven't had before, because this is a nod to that time that Paula was talking about, when even the idea of having modulator therapies was a dream for the CF community. And, seeing children grow up and cross that threshold and join that and transition over to adult care was a dream for many early families. And so today we've reached many of those milestones, which is just an incredible testament to our progress. And so today, this tagline really represents that we're a community and we are going to continue to be driven by a dream. And Milestones 3 is very much embodying this desire to pursue a cure. So if you want to go to the next slide, this really shows that our approach with Milestones 1 and Milestones 2 were really to launch modulator therapies. This was a time where we were investing heavily in research coming out of the 80s when we discovered the gene in 1989, and we were learning about the basic biology of this disease, and we were treating symptoms better. And now we were moving into how do we address this on a genetic level? How do we address this as a daily treatment? And we were just moving into this new era of research. And so the campaign raised Milestones 1, $175 million, and that closed on New Year's Eve one year, and then the next day, and we had our last gift at midnight, and then New Year's Day, Milestones 2 launched, and we raised $75 million. And those were undeniably essential to reaching all the milestones that we've seen, and hopefully that some of your grandchildren have benefited from being able to take some of these amazing modulators that are available now. So today we're really on the precipice of incredible science that's happening, and I'm sure you've heard so much about it, but there are new and there's novel technologies that are developing almost every day. I join research calls. I love taking notes, Paul. I took a lot of notes tonight, but I love hearing every update I can, because I always hear new information. I feel like there's always news headlines and new angles to how we approach things and understand CF. So without a doubt, pursuing a cure is going to be risky and it's expensive and it's going to take a lot of time. But I think there's a lot of momentum right now. And one thing the foundation is really good at is planning for the future. So we do know that if we don't invest these dollars today, we're not going to be able to cross that finish line tomorrow. So if you can go to the next slide. I think in some ways, people probably have asked the question, well, why are we doing this now? This seems like a challenging time. It seems like why is now a good time, right? And the truth is that as an organization, we are seeing a lot of momentum, and we are jumping headfirst into our long-term strategic plan. And we haven't been in campaign mode since 2015. That is actually quite a long time for an organization that has had as much progress as we've seen. And, I mentioned that we're at this pivotal point in science, and our primary goal really is research. We want to develop therapies for all patients with the ultimate goal of a cure. And as Paula highlighted, we really are also entering this new era in CF care. And we want to make sure that we have, there are life-changing treatments available, but not everyone has access to that. And not everyone can benefit from all of that. Just because you're eligible for a modulator therapy doesn't mean that your body's going to respond well to it. So we really have to make sure we have all the resources necessary to meet all these needs, and they're going to grow over time. So we have to be very aggressive with launching a campaign, and this is going to be an essential part of our fundraising efforts the next few years. And I think it's also important to note, coming out of the pandemic last year, you know, chapters were not able to do as many events. Fundraising generally was down. And so this campaign is an important way to balance out, you know, how we're going to get back on track in the next few years. So next slide. So we have 3 main objectives, pretty straightforward. So I mentioned already, we're building our momentum as we advance on this path to a cure. We want to advance the level of care to support everyone's journey on this disease. We also, a big emphasis with this is that we want to double our Legacy Society membership. We're actually, as of, I think today, at 819. I do keep track of it daily, but we want to get up to 1,500 by the end of the campaign. I'll talk about our timeline in a minute. And we also want to continue to recognize all of our donors and volunteers. You know, that's a huge part of what we do as a foundation. We want to continue to focus on the stewardship of our community and all of you tonight. And we want to celebrate those gifts that we get today, but we also want to celebrate the gifts that are committed for tomorrow, because those are just as important. Next slide. So this is our campaign timeline. Believe it or not, we actually launched last year. That was really our planning phase, or some call it our silent phase, and that is very common in a campaign. It wasn't specific to being in the midst of COVID. And now that it's 2021, we're really rolling this out in a very big way. We're presenting this to all of our boards across the country. Obviously, we're here and we're so excited to share this with all of our Grampions tonight. I know we couldn't do VLC this fall, but our plan is that spring next year, we'll be able to recognize all of our campaign donors, and that the campaign will be a big part of VLC next year. And so we want to continue to talk about it, and we really want this to be the worst kept secret by the end of the year. There is absolutely no reason we shouldn't be talking about it. And then you can see the timeline goes through 2024. But, you know, as Joe O'Donnell, who I'll share his photo in a minute, he always says our work is never done. So next slide. So here we are, Joe O'Donnell. We're very, very grateful that he was our 10-year chairman of the Milestones 1 and Milestones 2 campaigns. If you know him, you know he's relentless, which is very much what we embody as a foundation. And Joe lost his son Joey many years ago, many years ago, and he has remained involved ever since. He's one of those amazing families that, you know, saw those difficult decades of the foundation and has remained involved. And a couple of months ago, you might have seen on our website, he was featured on the Dr. Oz show. So there's a clip on there if you want to learn a little bit about him. But he also has a steering committee. So I would say he's back chairing our campaign committee. He couldn't say no. And he does have a wonderful steering committee that's supporting him along the way. And this committee represents all regions across the country. We also have a Tomorrow's Leader on this committee to sort of help us reach a new segment of our campaign donors. And then we also have an adult with CF on the committee. And one thing I do want to note, because I'm sure there is a question, is that you may notice that we don't have a financial goal listed right now. And that is intentional. Joe feels that we are too volatile as a foundation right now to lead with a financial goal. We want to be sensitive to the challenges facing the community, but we absolutely are going to continue to focus on engaging our most important donors, which are all of you. And we want to build this momentum. And then next year, we'll announce a financial goal. But I will say so far this year, we've already seen a lot of really great momentum. So even not having a financial goal, I don't think has impacted our efforts to roll this out. Next slide. So there's 3 ways you can join the campaign. You can, just like past campaigns, you can make a major gift, which is anything over $10,000 is considered a major gift. And that can be an outright gift, or it can be pledged. You can say, I want to give 10, 20, 30,000 over 2 to 5 years. So that is one way to do it. You can also make a planned gift where you simply verbally tell us that you are joining the Legacy Society and that you have included the foundation in your plans, and that is complete. You don't have to disclose the amount, you just join the Legacy Society. And we'll celebrate the fact that you've joined as part of our campaign. The third way is a little bit different. This is how we're being a little more progressive with our campaign than in past years. So you can do what we call a blended gift. And this is a combination of a major gift and a disclosed plan gift. So you're basically making a cash gift today, and you're also committing to a future gift, but you're telling us the type of the gift, the amount of that gift, and it gives you a total dollar value. And so there's a great example on this slide that I wanted to share. Jessica Coniglio actually is our Tomorrow's Leader that's on the steering committee. And she never thought of herself as someone who could make $1 million gift. She tends to make, $5,000 donations to her chapter, and she wanted to do a gift that felt comfortable. She also recently relocated to Manhattan, so she didn't feel like she had a lot of extra income. But, she made a commitment to give $5,000 a year for the next 4 years, which is a $20,000 gift commitment. And then she also added a $30,000 gift in her will to the foundation, and she told us that amount. So for Jessica, that makes her a $50,000 club level donor. And that is a high level of recognition, and she felt good about it, and we're going to celebrate that. I don't have a slide for this, but we recently had another conversation with, as some of you may know, I'm not sure, but Mark and Jan Fisher, they're in Seattle, also Grampions. And this past year, they reached that age of 70 and a half, where you have to now make a required minimum distribution out of your IRA. And that was new to them, and they didn't actually feel like they needed that as part of their income. So for them, they used that as what's called a QCD, a qualified charitable distribution. And so they made that as a 100% tax-free gift to the foundation. It ended up being $20,000. And then they also added the foundation as a beneficiary of that same IRA account in the amount of $30,000. So again, it wasn't really a cash gift they were making today. It was a gift they had put aside, but it made them also a campaign club level donor at $50,000. So I feel like, we're opening up new opportunities for donors to join this campaign in new ways, and we're hoping that this becomes sort of picks up momentum over time. So another reminder that major gifts doesn't necessarily have to be cash today. There's a lot of sources for major gifts. If you use a donor advised fund because you put funds in there at one point and you had a tax deduction, you can allocate that, or you can even include the foundation as a beneficiary of that donor advised fund, so that after your lifetime, you can make sure it gets distributed to the foundation. Otherwise, that financial institution oftentimes disperses it to other charities of their choice. You can also do major gifts through a family foundation. You could do stock gifts. So there's a lot of ways to do it. And we are seeing a lot of momentum. I will say, just since the beginning of this year, we have had close to $8 million in disclosed plan gifts. And that is money that we did not know we had, allocated for the future. And that is so incredible. So next slide. We're excited. We're going to bring back these club levels as a recognition opportunity. This was very successful through the first 2 campaigns, and it's also very standard approach for recognizing significant support. And then one thing I will note is that we are also adding a $2.5 million and a $5 million level, and we do have some donors that are earmarked for that. Next slide. So this is just an example of how we're going to recognize donors for the campaign. At VLC next year, we're going to celebrate those that have joined by publishing the Milestones 3 campaign club list for those that are at those levels. And then we'll also publish the Legacy Society member on a second list. So some donors will appear on both lists. And then throughout the coming years, we're going to have additional recognition opportunities that are going to be really important that we're investing in. So we're going to also roll out a campaign newsletter. And then we're looking at some other recognition ideas with the steering committee right now. Next slide. Okay, so we're going to get into the Legacy Society, which is my favorite part to talk about. So, what is the Legacy Society? How do I join? Well, you can join by, very simply, you can leave a dollar amount or a percentage in your will to the foundation, or you can designate the foundation as a beneficiary of something like your IRA, your 401k, or even a life insurance policy. And believe it or not, this is becoming more and more popular. In fact, I'm a Legacy Society member because I've allocated a percentage of my life insurance policy that goes to the foundation. So that's how I joined, and that is becoming more popular. It is named after the Paul DeSantis legacy, or the Paul DeSantis, who is our doctor that developed the sweat test, which, as you know, is really the gold standard. So we want to make sure we have an homage to that history there too. But we typically call it the Legacy Society. Next slide. This is probably a recap of what I already said, but the opportunities to give a planned gift are broader than people sometimes think. The most common way is just to leave a bequest in your will. In fact, 90% of gifts that we receive are just straight, administrating gifts that are coming out of a will. But we are seeing this increase in beneficiary designations. We're also seeing these donor advised fund designations. But one thing I also want to add, and I didn't put a slide in for this, but there's also a very large variation on who are the members of our Legacy Society. I think people often think there's a type, maybe it's they think of Grampions, but I will be here to tell you that we started looking at some national plan giving data a couple of years ago to look at those trends. And we want to make sure legacy giving continues to be a very important part of overall giving to the foundation. If this becomes just another part of, like when you look at your calendar of events, we want to see Legacy Society on there. And so this is so interesting because we were looking at data that shows, if any of you work in the financial industry, you know that baby boomers are the largest group of donors that are making charitable bequests today. And in the next 2 decades, this generation is going to be transferring up to $60 trillion to younger generations, which is a tremendous amount of money. And the financial world is calling this great transfer of wealth, and there's a lot of studies around it. So we looked at that, and then we also looked at a separate plan giving study that was done over a period of 15 years that showed that of older Americans, about 5% who both donate and volunteer to charity of choice are more likely to leave a gift or have left a gift in their will. But interestingly, of those surveyed, 33% said that they would leave a gift if they were asked. So that was very interesting to us, and it made us realize we need to talk about it, and we need to have this part of our fundraising culture and how we talk to our community about it. And then quickly, I will just say that, and this is the only data I'll share with you, I promise, but there was a study also done by US Trust Insights on Wealth and Worth, and that showed very recently that 43% of adults who are 18 to 65 have already left a gift to charity. So clearly, there's a group of these younger generations that are looking at major financial decisions earlier in life. They're getting married, they're starting their 401ks earlier, they're setting up their wills earlier than previous generations. So the takeaway, really, if I can just share one good takeaway, is that it does not matter who you are, what type of gift, the size of the planned gift. Absolutely everyone can join Legacy Society and leave a planned gift to the foundation. So next slide, I'm really excited because I saw 2 special guests because I see Jerry too. So I'm actually going to turn it over to Bonnie Binker, and maybe Jerry's going to join in to share some exciting news and to share her story.
Thank you so much, Amanda. And Kent and Kathy, thank you so much for having us today. Jerry, if you want to put your picture up also, but to introduce myself, for those of you who don't know me, my name is Bonnie Binker, and I am incredibly proud to be the grandmother of 3 amazing grandchildren. And the one who you see behind me, that's Delaney. She is our almost 11-year-old and 2-week granddaughter, who is the person who brought us to the Cystic Fibrosis Foundation. She was diagnosed when she was 15 days old. And Jerry Socherman, wave Jerry. He is Delaney's godfather. And we are honored to be the co-chairs and founders of the Cure Cystic Fibrosis Miami Foundation that we founded in Delaney's honor. And it was our way of raising the most money we possibly could for the Cystic Fibrosis Foundation. And our foundation also helps families who have a loved one with cystic fibrosis when they are suffering food insecurities due to natural disasters. So when there's a hurricane or the freezes in Houston or COVID, we try to help out by giving monetary help for them to not have to make the decision between food and their drug copays. But we are also thrilled that last year, Amanda came to us and said that we have a great idea for you all. How would you like to do a match or a challenge or a gift that got people involved in the Legacy Society? So last year was our first year. And Amanda, how many people got signed up last year?
I think we had 90 of the 120 that we got in 2020 were all joined during the match time frame. So very successful.
We are back to do it again. And that match is, I think, starting today, because it officially was rolled out this afternoon through December 28th. Anyone who signs up to join the Legacy Society, Cure Cystic Fibrosis Miami is going to donate $500 in your name to the foundation, up to $50,000. And it really is just a way that we can highlight the Legacy Society and the importance of it. And why Amanda came to me, if you don't know, I am the national chair of Grampions, and we decided that the Grampions was a great place for us to start, although little we learned through this that tomorrow's leaders and everybody else in between were also just as interested. And for me, the importance of the Legacy Society is that Delaney is doing really, really good right now. It's been a bad year for her. She was diagnosed with cystic fibrosis related diabetes, and she is colonizing Pseudomonas this year, but she's really doing well. And that's because of everyone who came before us and helped to lay that foundation of even before Milestones, and then Milestones 1 and Milestones 2. And I have to look for where the future of the foundation is going, because the past was taken care of for us. But what's going to happen to the future of the foundation? I know
No, we lost her. If she jumps back on, maybe Jerry, you can jump in.
Am I there?
Oh, there you
Hello?
are. You're back.
Okay, sorry about that. I know that there is going to be a cure, and that our children and grandchildren and our other loved ones with CF are going to be cured. But what does that cure mean? I personally believe that Delaney is going to need a lifetime of care. It is going to be a long, wonderful, beautiful life, but she's still going to need specialized care. And who's going to donate to a disease that's already been cured? It's going to be hard, but we need to support the Cystic Fibrosis Foundation for that entire lifetime. So what a better way to do it than to leave a legacy gift. We're going to be here a long time too. I know it's a sensitive subject, but we are going to be here a long time. But that gift is going to live long after us, and it's going to keep our loved ones healthy their entire lives. And last year, I always talked about what really drove me, and it was wanting to know that my story was told by me when I'm gone. And what that story is
We lost you again, Bonnie.
Oh, Jerry,
Now go ahead.
they got me again. Sorry, I don't know
Yes.
what's going on. But Jerry, just jump in if I freeze again. But,
Okay.
you know, our family is dedicated to making sure that this foundation lives on long past us until the very last person who was ever born with cystic fibrosis has their long, incredible life. So I ask you in joining me and making this step, if it's something that you've never thought of, please start thinking of it. And it's something that you've always thought of but haven't done it, now would be a great time. You can talk to your staff at your chapters. You can talk to Amanda. You're always welcome to contact me and talk to me. We just ask you to please, please join us in this wonderful way to give to your loved one with cystic fibrosis.
Thank you so much, Bonnie. Jerry, anything else you want to add, or Bonnie?
No, Bonnie generally covers everything, as you all probably know. So, you know, we're just honored to be able to offer this this opportunity for the foundation to increase the Legacy Society membership. And you know, I mean, I've been a member for some time. Bonnie's a member now. You know, as well. She's been, and you know, we're excited to be able to grow that group and how important it is to be able to provide for the future of the foundation.
I guess I'll open it up if there are any questions. Or if this venue may not be the right place, contact me directly. It is confidential, and we will make sure that you get matched starting today, which is exciting. But I know we might have some Grampians that are on the call that have left a gift. If anyone wants to share their story, I want to make sure you feel like this is a time for you to do that if you're willing or interested.
Well, yeah, I'll be more than happy, Amanda. This is Kathy again. We jumped in last year. Thank you, Bonnie. It was kind of an incentive for us to do that, but we probably would have done it eventually anyway. It was just the timing was good for us and whatever. But I think the important part was, and Amanda, you touched on it. The reason why we wanted to be involved, obviously, is because of our grandson, but also because of all the other CF patients out there that are going to need our assistance. So it's not just for him, it's for everybody. But I think the important part that I don't think everybody grabs onto is the fact that there's no dollar amount. There's no specific dollar that says to be a part of this group, that you have to, you know, donate your life savings. So I think the message should be, we want involvement. We want people to Bonnie, you've said it best. I don't know if I could any better. But I think it's important that we do leave something for when we're not around, and we're not here for great strides. We're not here for all the other activities that are out there. This is our opportunity to say, yep, we will still want to be remembered. So, you know, we worked with you, Amanda, and we did $50,000, and it really worked out well. So we're so happy to do that. Even taking a look at maybe even upping that number, you know. So we'll see how that works. So anyway, yeah, we're very happy to do it, and hope we get some response to move forward with that. So.
And Amanda is so great to work with. You made it so easy. Sent us everything we needed and made it as easy as anything could possibly be. Yep. So thank you.
Thank you, guys. And just one more thing I wanted to add. We had reservations about doing this because we thought that, you know, how can we leave money to the foundation and not make sure that Delaney had everything that she was going to need in the future? And that was our reservation, because we thought, you know, all of our grandchildren, but especially Delaney for her medical needs. And then we realized that if we didn't leave the foundation in good shape, there was no point in worrying. That's part of your reservation of why maybe you've not done it yet. I just wanted to add that in.
Thank you, Bonnie. I know anything? I know we're cutting short on time here, but if there's any other questions, you can reach out to any of us. How are we doing, Hannah?
Well, actually, we are a little more time. That's all right. This is
Okay.
a great conversation, Amanda. Obviously, you can be reached, and so can Paula if anybody has any further questions. But boy, I can't thank you two enough for help joining us tonight, and thanking everybody else that's part of this call. And I think the important part is we've learned a lot in a very short period of time, and it's Paula and Amanda that kind of made that happen. So, but I also want to point out, this is kind of another thing that there's going to be other opportunities for the Grampions coming down in the next several months, similar to what we did tonight. And I think that's an important thing to kind of know what that group and organization does. It provides opportunities to meet with great people like you two. And we'll have more of this on down the road. So we're very excited to be a part of this organization. We really are. And I hope everybody sees the same thing that we do. So anyway, unless there's anything else, have a great evening, great rest of the year, and we'll have some other things coming down the tube later on. Thank you all for joining us tonight.
Thank you. Bye.
Thank you.